Alcohol and your heart. Today we will discuss the current alcohol consumption guidelines and how heavy alcohol consumption can impact your cardiovascular health. First, let's review what is considered one standard drink. 12 ounces of 5% or less alcohol beer, so a standard bottle of beer, 5 ounces of 12% or less wine, red or white, or 1.5 ounces of distilled spirits, examples being vodka, gin, whiskey, etc. Canada's alcohol consumption guidelines were updated in 2022. No more weekly maximum number of drinks. And a few key takeaways are that all levels of alcohol consumption are associated with some risk, so drinking less is better for everyone. And the risk of negative outcomes begins to increase with any consumption. And with more than 2 standard drinks per week, most individuals will have an increased risk of injuries or other problems. Consuming 3 to 6 drinks a week can increase the risk of developing certain cancers, such as breast cancer or colon cancer, while more than 7 drinks per week can increase the risk of developing heart disease and stroke. Heart disease is the second leading cause of death in Canadians. For many years, there was a commonly held belief that drinking in moderation offered protection against heart disease, and that was widely publicized. Research in the last decade is more nuanced, with the most recent and highest quality systemic reviews showing that drinking a little bit of alcohol neither decreases nor increases the risk of heart disease. But at higher levels of use, alcohol is a risk factor for most types of cardiovascular disease, including coronary artery disease, heart attacks, heart failure, high blood pressure, atrial fibrillation, and stroke. The most current guidelines now suggest you limit your weekly alcohol consumption to 1 to 2 drinks. But this is considered a low risk, not a no risk guideline. Impacts of heavy alcohol consumption include increased risk of cardiovascular disease, increased blood pressure, increase in LDL, your lousy cholesterol, increase in triglyceride levels, a reduction in your happy and healthy HDL cholesterol levels, increased risk of stroke, heart failure, and arrhythmias. Heavy alcohol consumption can weaken and thin the heart muscle, affecting its ability to pump blood efficiently. Increased weight and increase in waist circumference. Many alcoholic beverages and their associated sweeteners and mixes are high in calories and low in nutritional value. And there is also an increase in appetite and tendency to make poor food choices. An increased risk of developing diabetes. With an impaired ability to regulate blood sugar levels, alcohol can cause serious fluctuations in blood sugar levels depending on the type of medications you're taking. Always note the impact and interaction of alcohol and your medications. For more information, speak to your exercise therapist, visit our website at gethearthealthy.ca, and view our calendar of live events on our website. Thank you very much.